Hey folks, it's Doug Blake with Body Design University. We are educational partners with the American Council on Exercise, and what we're going to do is go over their 6th edition. I'm going to do a general overview study guide for this particular edition for the Certified Personal Trainer certification course. 6th edition looks a little bit different than their last edition, and if you have not gotten it, this is kind of what it looked like. It's got a large binder. It's much thicker book, and so just keep that in mind as you're going through it. A little bit easier to handle, I guess, in one sense. They've done a lot of different upgrades to the materials as well as to how it is presented in this edition. They did a great job. They added a number of different things that'll be really helpful. And then as well, what you'll need, of course, is your BDU study guide. So this is basically the what we call the exam blueprint and study guide. This helps you to understand a little bit more about how the exam is structured, how much is being pulled from different parts of the actual textbook itself, and that's going to help you out. The other thing to always keep in mind whenever you're studying, now remember, I'm going to go through this with you, go through all of the chapters, not in an in-depth way. That's kind of the idea of the general study guide, is to help you understand how to navigate your studying based on the amount of time that you have to study. And that's why a general study guide, to help you appreciate where the material is coming from in the textbook, will give you some assistance. If you only have 2 weeks to get ready for the exam, it's going to be a challenge, right? If you've got what we recommend, which is anywhere between 60 to 90 days, 2 to 3 months of study time, that's going to be ideal. And if you do have that much time, then I'm going to explain to you exactly how you should go through this. But again, keep in mind, whenever you're studying, now what I like to do is I like to basically have two types of paper, just lined paper. Like I'll use a notebook just like this, for instance. So that's got lined paper, and that's for when I'm writing definitions and concepts, like if I'm just literally writing. Because remember, the goal when it comes to studying, especially with academic material like this, read, write, recite. That is a standard basic way that you begin. If you're not comfortable or you're not familiar with how to study properly, or if you're struggling with your studying skills, that is a great way to start the process. Now, look, if you already know how to study and you've got it figured out, no issues, great, then use whatever works for you. But the idea is that if you don't, for sure, use what we know works from a memorization standpoint. Because remember, knowing the material comes from memorizing it first. You've got to memorize terms. You've got to memorize concepts. Knowing what your learning style is also very helpful. If you're not comfortable studying, and when you read things, you don't memorize them well, or you get distracted easy, those are big issues, obviously, that you want to take care of those right from the get-go. Remember, reading is not studying. Okay, studying is a much more in-depth, interactive way of dealing with materials. Reading is great. It's what starts the study process, but just reading through something is not studying. So anytime I talk about studying or memorizing as I go through this with you, just keep in mind what I'm really saying is, don't read it. I mean, you got to read it, of course, for the first time. You got to at least run through it. But when I say study and memorize, that means now moving into an active mode where you're not just looking at it, seeing it, but now you are doing those things that we know are going to help you to retain the information. And one of those is the classic read and then rewrite it and then say it out loud methodology. And you got to do that over and over. It works for the vast majority of folks. The other thing that I highly recommend, now I've got a printer back here. I just grabbed some printer paper and I use this for drawing, because drawing is another way. Remember, part of the reason you read, write, and recite is to get this physicality of writing. So drawing fits into that as well. So for sure, when you get down to your study time, make sure you're using both modalities of writing, so to speak, right? Drawing, if you got to draw out concepts, if that helps you to memorize it, you got to do it over and over again. Repetition is important. The other thing to keep in mind is that your exposure to the information is also critical, or what we call the frequency of exposure. And frequency of exposure means you're better off doing 2 30-minute sessions per day of studying than one hour study session. If you've got 2 hours to study, break it into 1 hour study sessions, one, in the morning and then one in the afternoon or evening, something like that. That's the recommendation. Always keep in mind, everything that I'm going over with you is always going to be essentially based on whatever your schedule allows. I mean, I can give you the ideal explanation of how we study, to get through all of this material. And there's a lot in here, obviously. But what we want to be able to do is to utilize the best case scenario and then take it from there. Whatever, this is ideal. Whatever you're able to do, you're just going to have to work with that. And that's one of the reasons why when we go through the study guide, it kind of points you in a direction. Ultimately, you'd like to know the entire book. That's how you're going to pass the test, if you know the materials. However, if you don't have 90 days or 2 months or even a month, you're going to have to hone in on certain areas that are a little bit more targeted, more important from a representation on the test perspective. And that's what I'm going to go over with you. So just keep in mind, I know it looks like a lot. It is, but they've got lots of, what ACE did was they put a lot of sort of extraneous information. They've got lots of pictures. So if you go through it, a good amount of the actual book is just some pictures and lots of tables. They give you a lot of extraneous information that's really designed to kind of help you in the real world. So just keep that in mind. The written material, decent amount of that as well, but it's not the entire book. So just going to keep that over here. And what I want to do is go over now the exam blueprint. I want to explain a couple of things before we actually move into sort of this general explanation of the different chapters. Some precision study tips. Again, I told you the read, write, recite. Ideally, you should have 3 months. If you don't, now you've got to manage back from that. If you only got 2 months, then you've got to make decisions about what you're going to study priority-wise. If you got 1 month, that's even less ideal, but you can still do it. You just have to focus on specific areas as priority, right? If you only have 30 minutes a day versus an hour a day, now you're going to have to sort of reverse engineer how much time you're going to have to spend on certain areas of the textbook. Okay, so that's just something to keep in mind, that there's this ideal scenario, and if you don't fit into that ideal scenario, then you've got to, like I say, kind of reverse engineer how much time and where you're going to target your studying. The recommendation, of course, is study every day, at least an hour, 15 to 20 minutes, and then take a short break, another 15 to 20 minutes, short break. Give your brain a little time to kind of readjust after you've hit it with 20 minutes to 25 minutes of studying, whatever the case is. We highly recommend the Quizlet Study App. We do have proprietary ACE study materials in the Quizlet. If you've done the BDU course, the Quizlet is an exceptional study resource, mainly because of the way it exposes you to the materials. And again, it's not just reading. Reading is not or flashcards. Flashcards are fine, but they're only a very small part of the totality of learning modalities that are available. And that's what Quizlet does. It's just a great way to go through material. The other thing is the ACE study group on Facebook. One of the best things about that is that you can ask questions and you can have students some students have figured a lot out already, and they'll respond back to you if you put questions in there. So we definitely Definitely recommend that. Now, I'm going to tell you the ideal scenario. And anytime I'm going through, if I've got something that I'm trying to learn, what we highly recommend is that you do a single run through or perusal of the textbook. And let me show you how this works. Normally, if I just say peruse through the first time, you might make a couple of critical errors. One error that we see people make when we say just peruse through is they stop and they actually start studying. So they'll get to chapter 1 and they'll look at the table and they'll actually try and study the table, or they'll get to expand your knowledge and they'll start, no, that's not what we want to do. Your initial perusal is really designed to give your brain a little bit of exposure to the material. Here's what we know. There's a lot of stuff in here that you might actually already know. Maybe not the specifics of it, but you already know a good amount of it. Well, the material you know, we don't want to spend a whole lot of time just looking at that because you already know it. The goal is to focus on those areas that you don't know. So the initial perusal allows you to move quickly through the material. It exposes your brain basically to the material in a very general sense. Okay, so I always recommend doing a single perusal and just reading through. And in ACE, what they've done is they've given you a number of, like I said before, extraneous boxes of information. One of those is the expand your knowledge box. So these are kind of outside the normal copy or the normal written text. And on your first run through, what I'm going to recommend you do is don't read any of those. Just read through the text itself. Okay. Do not, that's number one. So they're going to tell you they have an expand your knowledge box. They have lots of figures. For instance, they have lots of tables. Don't worry about any of that until you do your second, more specific targeted run through. Your initial perusal is you simply read that and then go to the next page. Okay, read through. That's number one. Don't read any of the tables. Don't read the expand your knowledge box. They have an area, again, expand your knowledge. It doesn't matter what chapter I'm showing you. They have a think it through box. Great material, but you're trying to be strategic in your studying. So don't read through it the first time. Get through the written material, the copy, what we call the copy, which is just the text. Read through it. There is a summary at the end. Don't read the summary. The perusal is a strategic way to quickly get a very broad 30,000-foot view of the material. Certain things you're going to know, a lot of things you're not going to know. So that's number one. The other thing I don't want you to do is I don't want you to look and go, oh, I didn't know that. I better look at, let me take some. No, not on the first run through. That's what you're going to do when you actually get to your chapter by chapter study or when you're going through the general study guide. Remember, there's a strategy to this. So you have to be smart. If you don't have a whole lot of time, okay, so look, if you don't have a whole lot of time to study, don't do a perusal straight through because it's going to take you anywhere, depending on how fast you read and how much time you have, it could take you up to, 4 or 5 days, and some folks up to a week to do a full perusal of the material. Well, if you only got 3 weeks to study for your exam, don't do the perusal. Okay, don't do that single. No, you'll go directly into your targeted study. Don't read again. This is the first run through. Don't look at the pictures. Don't do any of this. Just go through and get all the way through. It's not going to take that long. But look, they got lots of pictures. They got all of this extraneous information. Once you do that, that is the ideal scenario. Once you do that, that's when you're now going to use your textbook again with more targeted chapter by chapter studies that we also have at Body Design University. So you'll do your perusal, and then once you come back, that's where you're going to really target your study. So I've even got it in here. If this is the perusal, a quick read through, Skip over the mover method boxes, the think it through sections, expand your knowledge. Just go straight over those. You'll have more than enough time to read through them and look at them once you do the actual studying. We're not interested in that. And by the way, for the most part, that material you're probably not going to see on the exam anyway. Just keep in mind, ACE wrote this to help you pass an exam, but they also want you to use this in the real world. There's a lot of great information in here. And now once you've done your initial single run through, now your second run through is really what we're going to call quote studying, right? And that's what we're going to be getting into. And then of course, after studying the materials, you'll be able to then do the practice exam. So keep in mind, strategically, we're trying to help you to learn and memorize the material so you can pass the test. You're going to need a lot of experience and practice after that to be a really great personal trainer, of course. But in order to pass the test, you have to understand the material. In order to understand, you got to memorize it, right? So that's the whole point of this. The more time you spend in the materials, the better chance that that's going to happen. The more frequently you expose your brain to the material, twice a day is better than once a day. 3 times a day is better than twice a day, just as an example. But those are all ideal scenarios. If you don't have that time and you only have a couple hours a week to study, for instance, all you're doing is focusing even deeper into those areas that we would recommend. So once you do the practice exams, you're going to basically do one practice exam and study from those incorrect responses. So again, there's a strategy to the way we have this set up. You've gone through the materials. Boom, you take that practice exam, 150 questions, and doesn't matter how you do, you're using it as a targeted study tool. Your focus at this point, after you take that exam, is you'll be able to see all the answers, correct and incorrect, and you'll go, oh, wow, I didn't realize that, that was the correct response. I guess I understand now why I got it wrong. But what you want to do is go into the textbook again, go to those areas where that question is represented, and restudy those areas. We just call it target studying. You study off of that one test, and then you do the second practice exam. You do the same thing. Now that could take you a couple of days on each one of those exams, literally a couple of days to go through all the incorrect responses. They're not the same test. And by the way, there's 3 practice exams that we're providing you, but keep in mind, those practice exams are all different. And then when you sit for the actual national exam, if you see a couple of questions that are similar, okay, that's great, but it's going to be a very different exam. That's why you got to know the concept. So those are your precision study tips. And then please keep in mind the following as you proceed through the study guide. Memorization, of course, is at the heart of learning. You can check out the education planner, learning style assessment. ACE uses what are known as domains to group information categories. And so they have 4 domains that they use. And the idea is that out of those 4 domains, that's going to be all of the chapters, right? So all of the chapters are going to fall in some way, shape, or form into these particular domains. Each domain out of 150 questions has a certain percentage of those questions related to it. So domain 1, for instance, is interviews and assessments. So, and this is important to remember, this is why we do this for you, is it really helps you determine where you want to spend the majority of your time studying. Now, keep in mind, the ideal scenario is you're going to go through the entire book. You're going to memorize all the material as much as you can. If you don't have all of that time, then what it makes sense to do is to get an idea of exactly how many questions are going to be asked out of domain 2. Okay. So for instance, in domain 2, program design and implementation, that's 30, that's a third of the test. That's almost 46, 47 questions. So now think about this for a second. If you have all the time in the world to study, that's fine. That's great. You're going to study through everything. But let's just say you only have 3 weeks to study, or maybe even a month. Well, what are you going to do? It's probably a good idea to start your studying off with the materials that are most represented. And so, for instance, in domain 2, you might only have, in this case, 4 chapters. Okay, 4 chapters, the majority, 1/3, not the majority, but a third of the test is based on 4 chapters. And you might want to spend a good amount of time on those chapters. And that's kind of the idea. And so 4 domains: program modification and progression, program design implementation, interviews, assessments, and then professional conduct, safety, and risk management. The idea then is that not every chapter is represented on the test as much as others. That can be a problem if you think that all you ever going to have to do is study 4 chapters and you're going to do fine. That's not the way ACE works. They don't over-represent, right, one chapter more than other chapters. Now, they may have a higher percentage of questions from a grouping of chapters, but you're not going to know when you sit down for the test. So just keep that in mind. The point here is that when you look at the percent of exam questions from the domains, that's really for those individuals, for you guys that don't have a whole lot of time to study. Like I say, 2 to 3 months, you're running through everything. You're learning everything you can about all the information from all of these domains. And so just keep that in mind. So let's go ahead and get started. And remember now, running through these chapters, I'm hitting on the highlights. What we know is that the material that we're looking at here in this study guide is for the most part what is generally going to be represented on the test. Okay. So I'll give you an example. In chapter 1 is role and scope of practice for personal trainers. For the most part, chapter 1 is an introductory chapter. Now, it's not that it's not important material. You know, it's really important because it's got scope of practice, code of ethics. You can be guaranteed to get 1, 2, maybe even 3 questions from chapter 1. You don't know because ACE has multiple exams that they use and run through and cycle throughout the year. And you can get one exam that has 3 questions from chapter 1. You can get another one that has no questions from chapter 1. See, this is the challenge. But what we do know is that if you are going to get a question from chapter 1, it's probably going to be from this material in here. So just keep that in mind. We're always trying to help students understand that the ideal scenario is know everything. But if you can't know everything, well, what should you start off knowing more than anything? And that's going to be some of these other chapters that we talk about. Chapter 1 is not the highest priority when it comes to total number of questions asked from that particular chapter. I hope that makes sense. So chapter 1 is really an overview. And what I want you to kind of think about is that as you read through the material that we know probably is going to be more highly represented than others is the memorization of tables. One of the things that ACE did is they really put together and compiled a lot of the information into basic tables. It's a good idea to get into the practice as soon as you see a table to go ahead and take it and rewrite it and try and duplicate the table as best you can. So for instance, scope of practice, we have memorized, quote, the actions outside scope of practice. Okay, that's a column on table 1-2, and that's going to be in page 12. And what we're saying is, if you're going to memorize anything, if you're going to spend time doing anything, you need to memorize. And remember, when I say memorize in here, I'm saying read, write, recite over and over until you can do it with your eyes closed. Chapter 2, just as a for instance, again, you should memorize table 2-1, training parameters. What I'm saying is that you should be able to, after you're done studying through this, you should literally be able to go, okay, I know that table. And with your eyes closed, rewrite that entire table, all of the elements in it. That is the goal, ultimately the goal, because if you can memorize that, you get a question that's going to ask you in some way, shape, or form to retrieve some of that, you'll already know it. You'll have it, okay? So that's kind of the idea with going through these chapter summaries of material. So in chapter 1, benefits of physical activity. Remember what I said, a lot of this stuff you already know. Or if you don't know these specifics, it wouldn't be that difficult for you to kind of piece out on the exam which one of the 4 answers is going to be, right? Which one of those 4 responses is going to be the correct answer. So you should be able to know, for instance, table 1.1 on page 5 and review those health benefits that you're unaware of. Okay, so keep that in mind. You're aware of a lot of these things. Maybe some of the things you're not aware of. Well, those are the things that you'd write and try to memorize. Okay. Scope of practice is, remember, the legal range of services, where they're provided, and specific guidelines. Okay. For sure, scope of practice. You definitely. I don't know any test where they did not have at least one question on scope of practice. Memorize the actions outside your scope of practice column, like I just said on table 1-2. Again, these things should just kind of flow off your tongue. You know what you should not be doing, right? And ACE is really big, right? As well, they should be on things you should not be doing as a personal trainer. And then code of ethics, and that's going to be in the appendix. The actual appendix gives you the code of ethics. Very few, though, if any, questions will be asked about the specifics, but you should at least read through that. Referring clients to other healthcare professionals is another area for sure that if they're going to ask, it's going to be something related to that. Chapter 2 is an overview of the ACE IFT model, or the integrated fitness training model. Remember, what ACE is trying to do is to help you to understand why ultimately this model of training is the best way to deal with people and how to do it. What are the specifics? What are the parameters, acute variables? All of those things are going to give you a very general overview. That's why you don't want to pass over chapter 2. I put this as a high priority chapter because it's going to help you throughout the rest of the textbook. You need to memorize that first table on training parameters. Now remember, there's a traditional way of understanding training, and then there's the contemporary, and you should know what those are. Then there is the function, health, fitness, performance continuum. Once again, that's not a training method, it's a concept, right? Progressions and regressions, and it's a way of helping you to understand how you would move clients through particular training progressions, obviously, and regressions. The IFT model, it's a general understanding only. By the way, it's fully explained in chapter 8, right? Chapter 8 is an important chapter, obviously. But if you can memorize the different components and what those elements are in the IFT model, which by the way has changed, they made modifications just in case you were still stuck on the 5th edition. The 6th edition made it actually a little bit simpler, a little bit easier, and that's what you're going to want to know and memorize, right? Cardio versus muscular, and there's three basic elements to each of those. There is base training and cardio, fitness training, and then performance training. Those are different levels of intensity and sets and reps and all those other things, which, again, if you already work out and you train, okay, maybe you don't know everything there is to know about anatomy and physiology, but you should know some basic things just about what they're going to explain to you here. In chapter 2, rapport is at the very heart. You're going to get a question on rapport for sure. How many questions they ask. That's kind of up in the air. There is a big focus right now that ACE has pushed on the client-centered approach for training, which is why they added from the previous edition what's known as the ACE mover method. And they give you an entire section every time you go through a pertinent amount of material. They're going to give you what's called the the ACE mover method, and then the ABC methodology, right? So the ABC approach is what they call it. And the ABC approach, you're definitely going to want to know this, right, as you go through each of these subsequent chapters. They've done that to help, makes it a little bit easier because it's more methodical. So asking open-ended questions, break down, quote, barriers for discussion and communication, and then collaborate with your client. So the ABC approach. That's chapter 2. In chapter 3, the basics of behavior change. There is a reason why ACE has put behavior change at the beginning of the book, because they think it is that important. They want you to hit behavioral change really hard. It's an important component of the mover method mentality that ACE thinks is critically important when it comes to helping people achieve their health and wellness and fitness goals. So chapter 3's got a fair amount of material. You're going to have to memorize the different behavioral theory models. And when I say memorize, I'm basically saying, what are they? What is the health belief model? It's not a bad idea, by the way. And even though you have these bullet points, just kind of the way I've always liked to do it is to get it in my own words, right? To put down what they have on paper and get it in my own words. Now, sometimes as well, and I can show you real quick, instead of just writing it down, the other thing that that I found to be very helpful, and I know a lot of students, and I got this, by the way, by looking at some other students in the actual Facebook group, is this idea that when you're writing, you can make creative fonts, right? And so, for instance, I would, with the behavior theory models, I would, instead of just writing health belief theory and write down, I could do that to memorize. I might do something a little bit more creative, a little bit more interesting, that's going to make it stick in my brain. I would like right in the center of my sheet of paper, you know, a real kind of flowy health belief, and that's going to help me memorize. And then I can write some definitions and some terms. Remember health threat, health behavior, you know, and I can write and draw some things like that. Again, that's just a tip when it comes to the actual methodology of studying. But whatever works. I'm just saying there's lots of ways to be creative to help you memorize some of this. So there's the health belief model, behavioral theory. There is the self-determination, and then there's just a couple of things to remember about them. If they ask you questions, they're not going to be very specific about those particular behavioral theory models. But then you get to the one that we use the most, which is the TTM, the trans-theoretical model. We call it the stages of change. You've heard of it, unless you've been living under a rock. You know what the TTM is. It's the five level stages of change: pre-contemplation, contemplation, and the rest that you're going to go through, all the way to maintenance, right? So just keep that in mind, that when you're going through the stages of change model, you understand what does it mean when a person's in pre-contemplation? What does it mean when a person is in contemplation, right? What does it mean when they're in preparation, right? What does that look like? How do you talk to somebody like that? And they give you basically all of that information, right? So, and then the action phase, simple, and then the maintenance phase. Those are your 5 phases, right? You should be able to rewrite table 3.1 with your eyes closed, right? That's kind of the idea. As we continue through the chapters, you understand where you're going to spend your time. Look, you can always just put the video that you're watching, you can just click and then go and spend some time studying through that part. Absolutely. Know the traits and goals columns for sure. And then the strategy column, not as important, but it is good to know if you have enough study time. That's all we're saying. Okay, you got to gauge your particular ability and how much time and ability and capability to spend sitting down and studying. So just keep that in mind. Self-efficacy, you got to know the sources of self-efficacy, performance experience, right? Vicarious experience, and know what they are. It's a good idea to know what they are in less than a sentence. You should be able to basically say performance experience is basically what I have accomplished prior to trying to make a behavior change. What have I been able to do? What have I already done? Me personally. Vicarious, what another person has done that I can look at that'll help me, right? Verbal persuasion, people giving me affirmations, accolades, things like that. And that's how I would do it with remembering the sources. Then there's decisional balance. Don't let terms throw you off. Don't let the terminology, if you're confused by the terminology, you just keep saying it over and over, keep rewriting it over and over. It'll start to click and make sense. Pros versus cons related to the behavior. Operant conditioning. These are, again, questions that they'll ask will be something like, given this client does this and feels like this and said something like this to you, what would they be operating under? Or how would you describe the type of behavioral change model that they're, you got to be able to know the differences between health belief, self-determination, operant conditioning. That's basically what that's saying. So when you read through it, think if there's some sort of connection you can make to either your personal situation, training, lifestyle, whatever, or with others. That's one of the, by the way, that's one of the ways that this can, you can really memorize this and make it interesting, make it personal. It's a lot easier to memorize it. Chapter 4 is on effective communication, goal setting, teaching techniques. Okay, they think that this is pretty important stuff. They do. And so you need to understand the 4 stages. This is the critical part in chapter 4. The rapport stage, investigation stage, planning stage, and action stage. And by the way, those 4 stages of the client-trainer relationship are going to be explained more fully, right, as you get through the rest of these chapters. For instance, the investigation phase is assessments, right? How you got to do assessments, you got to do postural assessments, you got to do performances, you got to do all of these different assessments. Well, that's part of that investigation stage where you need to be actively listening. You're going to be using forms, understanding motivational interviewing. Those are the things that you really need to spend more time than any on chapter 4. If you are crunched for time, that's your targeted area of study. Chapter 5. Okay, so chapter 5, take a deep breath. Step back, for instance, for a minute. And now this is where you're going to spend, right, a good amount of time. If you're going to study different areas, these are some of the basic, most fundamental areas that you want to spend. For ACE, pre-participation health screening, for instance, is going to be critical. The resting assessments, anthropometry, right? And that's chapter 7. As you get through it, I'm just giving you a little heads up here. They consider this to be very important information, and so they test a lot on these areas. So the pre-participation health screening, what is it based on, right? Those are your 3 things. Client's current level, physical activity, do they train or don't they train? Do they have any signs or symptoms of CV, renal, or metabolic disease, right? You got to remember a pre-participation. You're not even in the you haven't even started assessments yet. You're not even taking their body fat. You're not, no. You're just literally screening them to see if they should even be in the participation stage, right? You don't want anybody going through your screening process, your actual exercise screening process, before you know that they're even capable of making it through that screening process, or they need to see a physician. ACE is really big on a lot of clinical level information. If the client shows any signs of conditions, or symptoms of anything. And they have a lot of information in there in chapter 5 on this, because they want to make sure that you understand that it's important that if anybody shows a signs or symptoms of cardiovascular disease or illness, you want to whoa, back it off. And we're going to find that out here. You need to go to your doctor. You need to get this taken care of before I even do a postural assessment on you, before I even go through any of the next steps. And that's what the pre-participation screen is based on. And so that's what those three things. You have to use a PAR-Q, physical activity readiness questionnaire. They actually have a pretty good one. I forgot what page it's on, but they have an extensive one that of course you can use. Very professional, lots of questions. I mean, way over the top in that sense, right? You're not memorized. Don't memorize a PAR-Q, by the way. That's not your goal. Clearance from qualified healthcare provider is required when? These are things that you should know right off the bat. If they don't exercise regularly, or they have a known disease, or show signs and symptoms of disease. Well, what are the signs and symptoms? Well, they have that in there for you. You got to memorize. It's not that difficult. It's not a whole lot of signs and symptoms that you're looking for. As long as you're being hyper aware about it. If you're hyper aware of it and you're going through the process, right? And you're not just, doing things off the cuff, you'll be fine. This is in the real world, by the way. People that actually do exercise, people tell you, oh yeah, I train 3-4 days a week on the regular, but they show signs and symptoms of CV, cardiovascular disease. Whoa, you got to stop them. Got to go get medical clearance. And then there are additional forms. You should know the basics of the agreement to participate. What's the whole point of an assumption of risk? And by the way, what's the difference between an assumption of risk and a medical release or a lifestyle and health history? What's the difference between those? And they are very clearly laid out, and you should know those. Those are, it's almost intuitive, to be honest with you, once you look at the name. Agreement to okay, they understand. Basically what they're saying is that they understand what is entailed in the training process. An assumption of risk takes it to the next step and says, well, I know what it entails, and I actually know the risk because you have told me what that risk is. And so that's basically the difference there. What medications are they on? You need to know table 5.1. It's a good idea that when you look at table 5.1, that you group the medications, because basically the table for medications is going to tell you, does it elevate heart rate? Does it lower heart rate? Does it change heart rate while they're training or when they're not training? What are those particular medications? You need to know those classes of medications. And for the most part, those are just going to be blood pressure meds for the most part. So you do need to know. And by the way, that's not just for testing, that's real world stuff. I've been, for the years that I've trained clients, that was one of the main things I always wanted to know, because as a trainer, if I'm doing CV exercise, cardiorespiratory training, and their heart rate is not going up, and yet they're crushing it on the treadmill, what the heck's going on? Well, you need to know if they're on a beta blocker, right? Or an ACE inhibitor, right? Of course they're going to have it suppressed heart rate. So that's why you need to know that. Chapter 6. Okay, so here's the deal. You need to know some stuff about nutrition. ACE doesn't want you doing anything with your clients when it comes to nutrition. That's the easiest way to understand chapter 6. Important to remember their position statement when it comes to nutrition. Therefore, how much you'll need to study, not a whole lot. If you're crunched for time, is nutrition important? Here's the balance. There's me, Doug Blake, telling you it's the most important thing when it comes to changing people's bodies. There's also ACE, which is a NCCA accredited organization that basically says, don't be messing with people's nutrition. Send them to a dietitian, registered dietitian. Okay, keep that in mind when you go to take the test. However, with that said, what does ACE want you to know? And they do want you to know a lot about nutrition. They just don't want you writing diets for people. They want you to know nutrition labels. You should be able to help people to navigate through nutrition labels. That's really what this comes down to. You don't have to memorize table 6.3 word for word, but these 5 items, notice how I put it down. Clean, 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 right? That's going to be, they have a whole explanation. Separate raw from cooked. That's how I remember these 5 real simple 5 things when it comes to dealing with food items, right? Cook properly, refrigerate promptly, pasteurization for dairy and eggs. Okay, principles for proper fueling and hydration. Once again, NASM really clear. Don't be writing diets and don't say specifics. Give general information that will help people to make proper decisions. Send them to a registered dietitian. That's their take on it. Sports nutrition strategies for eating and hydration. Knowing things about proteins and carbs and fats is not a bad idea, but that's not going to be the main focus. They do give you some information on some supplements, which is really good. So we know, right, the latest research that they're using in their textbook basically says, like many of you already know, there's maybe 3 or 4 well-documented supplements out there right now that have, pretty well-documented efficacy. In other words, they do what they say they're supposed to do. Creatine says it's going to volumize your cells. Anybody that sells creatine, anybody that takes it is incorrect when they say it enhances performance. No, it doesn't enhance performance necessarily. It can act as a precursor to do certain things that may help a power athlete, for instance, or a strength athlete, but not the creatine itself. Okay, it's doing certain things to muscle cells. Same thing with caffeine. Caffeine will basically do A, B, C, and D. We know it does. Every research article out there and every meta-analysis says the same thing. It's great. Caffeine really works. It's a sympathetic nervous system agitator. It makes you more up. It increases free fatty acid mobilization, yada yada yada. All those things are pretty well known. And so caffeine is on that list. And what ACE is doing is they're saying, look, these things actually work. These are the ones that we know work. Protein shakes, sodium bicarbonate, right, to buffer lactate buildup in the blood. Okay, beta alanine. Okay, beta alanine is a great supplement. Okay, it's not going to make you better, stronger, faster, right? But it can help with your ability to recover and perform, maybe at some higher levels of performance. But beta alanine is a fairly well researched studied compound, and that's why they have that in there. I would read through it. Chapter 7, really important chapter. Resting assessments. Anytime you see assessments, that's a go-to chapter. Resting, it doesn't matter. Anytime you see assessments, chapter 7, chapter 8, okay, those are critical chapters. So the assessments taken at rest are going to be heart rate, blood pressure, body comp, height, weight, waist circumference. And again, what I've done is I've told you that when all is said and done, chapter 7 is pretty much about memorization. You got to know those tables: 7.2, 7.6, 7.7, and 7.8. Now, you're going to find out when you get to table 7.8, you're going to be like, whoa, wait a minute, that's a big table. You don't have to memorize everything on that. In general, just look at some of the basic numbers that they would ask you on a test. If a man has a waist to hip ratio of 0.9, right? So in general, men should have a ratio below 1.0. Those are the numbers you need to know. Women below 0.8. Chapter 7, in a nutshell, right there. That's basically what they're going to ask you. So, by the way, don't take the fact that there's only 1, 2, 3, 4, 5, 6 bullet points that there's not a lot in there. No. You're spending a majority of your time looking at those tables. That's the nice thing about this, is they've given it to you in a table, right? Just keep rewriting those tables over and over to really drill them into your mid and long-term memory. Chapter 8, is cardiorespiratory training, physiology, assessments, and programming. So now what they're doing is they're kind of moving into the way the IFT model looks. They're going to have a lot of mover method information in there as well. Once you start your basically the chapter by chapter, absolutely read through those. You don't, it's not necessarily that they will ask particular things on the, from those on the test, but they put it in there for a reason. And I think they're really, really great information on how to use the ABC protocol, right? Asking open-ended questions, right? Things like that, breaking down barriers, and then collaborating. So in chapter 8, responses to cardiorespiratory training. It's a good idea to memorize. For some reason, ACE kind of likes the anatomy stuff. So if you can memorize the anatomy of the heart, this is where drawing pictures comes in. So I don't know how many times I have drawn a heart, but I mean, it's just like you just draw the heart, top atria, bottom ventricles, left side systemic circulation, right side pulmonary circulation. It's just drawing over and over. Please, and I got to take another sidestep here. Please don't draw it once and then look at it. That's not the way to do it. Once you draw it and you do that and you look it over, that was great. Now tear it up and get rid of it and draw it again. This is the strategy. Here's what happens. I have students all the time telling me, well, I did your read write and I drew and I still didn't memorize it. Well, how many times did you rewrite it? Or how many times did you draw a picture of the heart? Well, I did it once, like you said. No, you don't do it once. You've got to do it over and over and over. I've drawn a sarcomere, a heart. I've drawn these things thousands and thousands of times just to learn over the years. Drawing a picture of the heart and labeling it and then looking at it for the next 2 hours, you're just reading. And remember, reading is not studying. Draw it, do it. It looks good. Okay, great. Tear it up, throw it away. Do it again. Do it again. When you use this, when you get this into it, that physicality of writing, you're not going to be able to not memorize it. Trust me, you'll be dreaming about it. You'll have nightmares. So they've broken, in chapter 8, they're breaking it down into the cardiovascular component, right? So that's the arteries, veins, capillaries, and then they also hit you with the respiratory part, the lungs, the alveoli, the, basically getting oxygen to the working muscles. Chapter 8 really, really has a ton of information. Again, you'll notice that there's a lot of memorize table this, memorize this table, memorize this part of this table. The goal here is to keep in mind that the memorization of that information is going to be critical for pulling that material back out on an exam. That's basically why you're doing that. The number here for training time during the week, 150 to 300 minutes a week of moderate intensity cardio training, right? 75 to 150 minutes of high intensity, or what they call vigorous intensity exercise. So you got to know those are basic numbers, right? That's what it is. American Heart Association, 150 minutes a week, minimum. That's not the warm up and the warm down. That's the actual training time, right? At whatever the intensity level is. ACE has been big on the zone concept of training using ventilatory threshold for a long time. You just got to know those, know VT1 and VT2 and the zones, right? Zone 1, VT1, right? Below that, heart rate wise, between VT1 and VT2 is zone 2, and above VT2 is zone 3. So just, you just want to keep that in mind as we're going through this. Chapter 9, muscular training, foundations, and benefits. Again, we're in cardio, now we're in muscular training, right? So know your anatomy. Yes, you got to memorize a number of these different tables. Now, don't worry about table 9.1, but you do need to know 9.2, 9.3. It's a good idea. Again, for some reason, they want you to know the neuron, right? The axon. And so know the parts of the neuron. Tables 9.4 through 9.11. In chapter 9, your goal here is to basically memorize those tables and understand where that material is ultimately going to fit in, right, into a training program. And again, depending on how much time you have, the goal is to memorize the muscle and the primary function columns for sure. Anything outside of that is fine. Epi, peri, endo, mycelium they're great fodder for questions, right? Knowing that the myofilament contains actin and myosin, right? Those are the terms you need to know. What are the different types of muscle fibers? Slow versus fast twitch. And of course, the subtypes of the type 2. Connective tissue. What is the sliding filament model? And this is something that you'll want to draw. That's where that drawing comes in. Definitely, you want to be able to draw those out. It helps. It really does help a lot. Human movement terminology. Static, concentric, eccentric. These are the types of contractions, right? Lengthening under tension, shortening under tension, or tension, but no change in length, right? Open kinetic chain versus closed kinetic chain movements, right? And again, it's a good idea. They actually give you pictures and drawings to show you exactly what these mean. But again, write it over and over, and you'll know. Open kinetic chain, my hands are moving and my body is not. Closed kinetic chain, it's like push-ups, right? My hands are stable and my body is moving, right? So closed kinetic chain. What are the benefits of muscular training? Muscular training principles, progression. So those you need to know for sure, right? Muscular training principles, progression, right? Specificity of training, right? Train a certain way, and that's the way your body will adapt to it. Overload to continue to make progressive increases in strength and power. You've got to predictably overload the muscle with more reps, more sets, heavier resistance, things like that. If I don't train for 2 weeks, 3 weeks, woof, my muscles go back, my neuromuscular system goes back to the way it was, in one sense, reversibility. And then if I do too much, my progressions, my ability to get stronger and more powerful, I start to get diminishing returns. The more effort I put into it, the less I get out of it, basically, is what diminishing returns is. And then program design variables. And this is where, again, ACE wants you to think about conversation and rapport development with your client. So needs assessment. What's going to be your training frequency and what's that related to, right? It's inversely related to volume and intensity. Exercise selection and order. Some of this, by the way, is just intuitive. Now it's down there, but if they're going to ask questions, it's going to be from chapter 9 and it's going to be on some of these areas for sure. Training volume, table 9.12, really important, I would say, to memorize that. Intensity, tempo, you got to know what these acute variables are. These are the program design variables, right? So number one, what are they? Needs assessment, training volume, training intensity, right? Training tempo, rest intervals. You got to know those. And then you have to then understand how you apply those based on the IFT model. And that's what they're just going over and over the same stuff, by the way, as you proceed through the rest of these chapters. Muscular training session components, warm up, know that, warm up 5 to 10 minutes. The conditioning phase, got to be appropriate to the client's level of fitness and what their training goals, right? Your starting fitness level, training goals. That's it. Those are the two things that determine the program that you're writing for them. Then you got to do a cool down, 5 to 10 minutes. You got to do a cool down. Okay. No, not even a question. Chapter 10, now we're back to assessments, critical chapter. It's going to be the same thing. You got a bunch of tables. You really need to know these by heart, 10.1 through 10.9. Why? Because these are the static postural assessments. And basically you're looking at all the different kinetic checkpoints, right? Looking from the front, looking from the side, looking from the back. And what are the most obvious gross imbalances and deviations? Now, again, chapter 10, you got to kind of sit down and get that paper ready to start writing and rewriting a lot, because now you have all of the different assessment tests. The unipedal stance test, right? Static balance. By the way, you got to know what these are for and who's it appropriate for. Okay, pretty straightforward. It's not difficult to memorize. It's just a fair amount you got to memorize. The Y balance test. That's a dynamic balance test. They give you, and they do a great job of showing you pictures and explaining it to you. So I'm not too worried about you memorizing it. You just got to put the time in to memorize it. And then the Mcgill's torso, muscular, and it's three tests. Okay, that's the only thing. It's called the test battery. It's flexion, lateral, and extension testing for endurance. Notice that trunk flexor endurance test, trunk lateral endurance test. And then the Thomas test, classic test that we use to check the relative hip flexor lengthening capability of the, hip flexors, i.e. the iliopsoas, right at the pelvis or the rectus femoris. And if you look and you see it, it's actually a pretty good test in real life. But don't conduct it if they got low back pain. That's the thing. That would be a question, right? A 55-year-old man, never worked out before, blah, 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 complains of lower back testing. Which of the following what test would you not do? And it would have three. The answer would be three that, yeah, you'd probably do maybe you do a unibalance, but then the Thomas test is on there. You need to know that somebody that complains of low back pain, you would never do the Thomas test on. That's the idea. And there's table 1013. Remember the 5 primary movement assessments, right? Bend and lift. You just got to memorize these. Bend and lift, single leg, push, pull, rotational. Those are the 5 main movement patterns that the human body goes through. You've got to know those. Then, now think about this. The sequencing of the testing is really pretty straightforward. You do some balance stuff, some stretching, flexibility, boom, and then you do muscle endurance assessments, then a muscular strength assessment. Know the difference between the two. Push-ups, body weight squat for muscle upper body and muscle lower body endurance, and then muscle strength assessments. 1 rep. By the way, who do you do those with? Do you do those with everybody? Okay. No, suitable for clients who are proper form with no. Well, wait a minute. My client on their pre-screening or these others said, yeah, I have shoulder issues, whatever. Would you do a 1 rep bench press assessment? No, not everybody. And those are things you need to know. Power, and then the SAQ, or speed, agility, and quickness assessment. Believe me, I'm not saying that you're going to do all of these tests in the real world. Some of these tests you probably never even heard of. It's not relevant. ACE thinks it's relevant, and you're taking their test. So that's why you got to know this. Chapter 11 is integrated exercise programming. From evidence to practice, there is a 5-step process. You got to know the process, right? Formulating a question, right? So if you look, the first letter of each word, F, S, S, I, E, think of a way to memorize those, those words. That's the way I would do it. Whatever makes the most sense to you, and then you'll know scrutinizing, incorporating, and evaluating. A couple of key concepts here: autogenic and reciprocal inhibition. You should know what those are. That involves the Golgi tendon organ and the muscle spindle fibers. Reciprocal inhibition, types of stretching, static versus PNF, and dynamic. Some of these I would imagine are intuitive. You already do them yourself, or you know something a little bit about them. You just get a little bit more in depth to understand it. Balancing exercises, you do need to know the basic progressions, right, for balancing. So arm progressions, surface progressions. How do you make a balance exercise more challenging by messing around with the surface that they're standing on? That's what that's telling you. Visual progressions. Yeah, try closing your eyes when you're on a Bosu ball, right? And you'd be like, so that's for balance. And then tasking. Program maintenance. Little interesting component here. If somebody is not training, on the regular, but you want to maintain what they've already accomplished from your training, these are some of the strategies, these 4 strategies. Training recovery is important, using the FIT, frequency, intensity, time, and type. And then, of course, some program design elements that are important to know. Again, if they're going to ask questions, it's going to be in these areas. A lot of this is just kind of moving through the material, trying to memorize as much as you can. Make this stuff connected in some way, shape, or form to your own personal life experience that you're dealing with right now, or with others that you might even be training or that you know that you exercise with. Chapter 12, considerations for clients. Now, once we get to sort of chronic disease, special population type of information, there are basic points of data to know. Okay, and that's what chapters 12, 13, 14, and 15 are about. I'm not saying they're not going to ask questions. You will. You'll get questions from these chapters. Just not a lot of questions, right? If you're going to get, any fair amount of questions, it's probably going to be from chapter 12. Obesity, of course, is an important thing, and chapter 15, which is musculoskeletal. So again, chapter 12, right off the bat, table 12.2 is a really important table to remember. Cardiorespiratory training. Again, here's your FIT. How do you use FIT, frequency, intensity, time, and type? How do you fit that into training people that are obese? BMI 30 or greater is clinically obese, right? 25 to 29 is overweight. And so these are the things that you consider as you're reading through chapter 12. And by the way, you're going to see a lot of similarity when it comes to these different chapters as to how you train individuals with these particular conditions. Chapter 13, what are the other chronic diseases? Now, you're going to focus on these different tables because each of these tables is going to guide you into the different chronic diseases, from diabetes, right? All of these chronic diseases. Do yourself a big favor. Look for similarities in the charts. Now, I know students that will literally they'll take each one of those chronic diseases, they'll redo the chart on a separate piece of paper, and they'll be able to look and notice the similarities between reps, time, all of the variables, all of those program design variables. And that then helps because they are very similar in many cases. Look to group the conditions, obviously, by fit similarities from a studying perspective. Chapter 14 is, they call it across the lifespan from youth to old age. Key thing to remember from a testing, youth need to be supervised, no single. Look at that one bullet point right there is going to help you a lot, right? Those are some basic things to keep in mind when you're training youth. Pregnant and postpartum women, ACE does like, believe it or not, they do like to ask questions on older adults and pregnant women. If you're going to get a question, it's going to be right there. You'll notice what I've done is I said, basically, memorize those tables. Read through the material, but remember what they've done. They've told you what's important by putting it in a table. Yeah, don't not look at the tables on that more specific run through. Focus on the tables because that's the critical data that they're going to ask you a question about. Okay, chapter 15 is musculoskeletal issues. Know the 3 stages of healing: inflammation, repair, and then remodeling. Table 15.1, common acute injuries, muscle strains, and ligament sprains, right? And there's different grades of those. Again, how many questions they're going to ask? Maybe a couple, not too many. Common overuse conditions. This is where we do see a fair amount of questions. So tendonitis, bursitis, fasciitis, for instance. Those are your main overuse conditions. Last chapter in this textbook is chapter 16 on legal guidelines in business. Look, you're not going to learn how to open up a business and run a personal training business by reading chapter 16, but they have to give you the information to round out the entirety of a certification textbook. They will ask you some questions from chapter 16. They're not going to ask you 10 questions. If you get 2 or 3 questions from chapter 16, that's probably going to be about it. Maybe 1 or 2 more, but not a whole lot. And the ones that they would ask you would be just to know what the difference is basically between, sole proprietorships, partnerships, things like that. What's the difference between a C Corp and an LLC? Things like that. So if you don't know this information already, it's a pretty good, the summary that you have here is going to be pretty much enough to answer some of these basic questions. You definitely need to know what negligence is. And again, some of these other forms that were talked about. Risk management, table 16.4. If you're going to memorize a table in chapter 16, there it is. So again, that takes you through all the chapters of the ACE 6th edition. Remember, tremendous amount of great material in here, and I hope that once you take the test, you'll go back and use it as an actual resource to help you train people. Obviously, there's a lot of things that they don't have in here that you can learn about more, but they made it a lot easier to handle and engage with the material itself. I believe they've given you the mover method, the ABC protocol for actually helping and assist clients through the communication process. I think that's a great idea. And then they've put the material into encapsulated forms, into tables, where they have taken what they thought to be really important information and put it in there right for you. Remember, read, write, and recite. Whenever you get to areas where you think you can make a drawing or some creative design, that will actually help you memorize the material better. Please keep in mind, the less time you have on this, the more you need to focus and hone in on those areas that I specifically mentioned to you and those particular chapters. And that's just the way ACE designs their test. I hope this study guide is helpful to you, as well as going through material and watching this video. We really look forward to hearing from you after you actually pass, because remember, our goal is to help you pass the ACE CPT exam on the first attempt. That is the goal. I know it's your goal as well. So we look forward to hearing from you when you've actually done that. Best of luck.